What causes pink eye? There are three main causes of pink eye, and in this video, we are going to talk about each one of these causes and how they are treated differently. Hi, I'm Dr. Nagori. I'm a board-certified ophthalmologist, and you're watching the eyefacts.com channel. First, let's talk about the scariest type of pink eye, which is bacterial pink eye or bacterial conjunctivitis. So why is this so scary? Well, depending on the type of bacteria that is causing the problem, the eye problem could have severe consequences. So by far, one of the worst types of bacterial pink eye is called gonococcal conjunctivitis. This is bacterial pink eye that is caused by a bacteria known as Neisseria gonorrhea, which, yes, you guessed it, is the same bacteria that is responsible for the sexually transmitted infection gonorrhea. In this type of pink eye, the eye is very red, super swollen, there's a lot of yellow-green discharge, and you can even have a pus-like discharge, and the eyelids are going to probably crust over. Patients can become very light sensitive, and they are generally very, very, very uncomfortable. In severe cases of gonococcal conjunctivitis, the infection can lead to permanent vision loss. This type of bacterial pink eye can happen from direct contact of a person's eye with infected genital secretions. It can also happen from hand to eye transfer and exposure during sexual activity. Now, in a newborn baby, gonococcal conjunctivitis can happen during a vaginal delivery if the mother has an active gonorrhea infection. This is a severe condition that requires immediate treatment. A bacterial pink eye from chlamydia is also possible, and both of these are pretty severe bacterial conjunctivitises that really need to be treatful. And both of these are really severe types of pink eye that need to be treated immediately. Thankfully, these are not the most common types of pink eye that we see when we're talking about bacterial conjunctivitis or bacterial pink eye. Overall, bacterial pink eye is not as common as viral pink eye, which we're going to talk about next, but it would still require some treatment with antibiotics, and you can usually get these pretty easily from an urgent care center or your eye doctor, and you will notice resolution of the problem when you start taking the medication. Also, if you don't have risk factors for high-risk sexual activity with someone who potentially does have this STI, then you're not really going to be at risk for having gonococcal conjunctivitis. The second cause of a pink eye is from a virus, and this is what we most commonly see, especially during the winter and cold weather seasons. Viral conjunctivitis is by far the most common type of pink eye, and allergic conjunctivitis comes pretty soon thereafter that. Viral pink eye is the kind of pink eye that we see when it starts spreading through communities because it's super, super contagious, but luckily it is a self-limited infection, which means that it just goes away without treatment. You just need to really treat the symptoms of it. Viral pink eye, because it is so contagious, you'll see it happen in crops, and aggressive and frequent hand washing is really, really important. You may also see an associated cold, or you may see that your child has some lymph nodes present. The best thing to do is take them into the eye doctor to make sure that it is in fact viral and not something bacterial. You can use cool compresses to feel more comfortable, as well as artificial tears, but it's not really going to shorten how long the pink eye lasts. Now, the third most common type of pink eye, which is also very, very common, is pink eye from allergies. Allergic conjunctivitis is becoming increasingly more common, where the rates of allergies are really going up, partly due to global warming. Studies indicate that the prevalence of allergic conjunctivitis used to be around 15 to 20%, and now we're seeing rates as high as 40% in recent years. There is another type of pink eye that is called toxic or chemical conjunctivitis, but in this case, you will have a known exposure to something that has caused the problem. A mild form of this is maybe when you get a little soap in your eyes and it makes your eye really red and your conjunctiva becomes irritated or inflamed. Now, in a case like that, you'll just wait it out and typically it'll be fine in a few hours. But in general, when we talk about what causes pink eye and the most common type of pink eye, patients and doctors are usually referring to viral pink eye. Now, there's another video on this channel that can help you to distinguish between allergies and pink eye, so you can check that out if you're interested. Hope you found this helpful. Remember to subscribe below, and I'll see you in the next video.